Hi everyone, this is Dr. Abdullah. Today's lecture is going to be regarding cancer medicine, better known as oncology, which is chapter 19 in the medical terminology textbook. So, we're going to be looking at some of the terms that describe the growth and the spread of tumors. We're also going to be looking at terms that relate to the causes, the diagnosing, and the treatment of cancer, and how we classify tumors based upon what pathologists actually look at. So I think it's fair to start off by defining the term cancer, right? And cancer is characterized by unrestrained and an excessive growth of a cell, and which takes us to another term called malignant, which is a malignant tumor which can invade and destroy any type of surrounding tissue. Now, some statistics and some facts. Cancer is responsible about 20% of the deaths in the United States. And, we live in a world of great technology and advancements in healthcare. More than half of the people who develop cancer are cured. Okay. So some of the characteristics of tumors, a tumor can either be malignant or benign. And I think we should know the difference between a malignant and a benign tumor. And anything that's considered malignant can multiply rapidly, it can invade, it can metastasize, which means that it can spread to surrounding tissue or spread from one organ to another. Okay, and the other characteristic of a tumor, it could be benign, which means that it grows slowly. That means it's encapsulated, it's differentiated, you can differentiate it, and it does not spread. Okay, so we know that the malignant tumors, they're more dangerous than the benign tumors. Okay, so I want you guys to also look at some of the images that you have in your textbook that shows you what a malignant tumor looks like, or what a benign tumor looks like, and how we characterize different tumors. Okay, so a very important term or medical term, carcinogenesis, which is the transformation of a normal cell to a cancerous one. That's what the term carcinogenesis means. Okay, so mitosis, which is when a cell divides, that can be clinically significant in cases of any type of malignancies. Okay, so carcinogenic agents, like environmental agents, like chemical carcinogens, radiation, oncogenes, things like that, they're considered chemical carcinogens, like cigarette smoking, insecticides, some other sources of radiation like sunlight and X-ray. These are all carcinogenic, so they could, things like sunlight and can cause different forms of skin cancer. Okay, your family history can play a role. Heredity, the term heredity, so anything that can be passed down from family or from generation to generation does increase your risk. Okay, so some genes that are implicated in certain cancers that are considered hereditary: breast cancer, ovarian cancer, and there is a table, and I believe it's table 19.1 or 19-1 in your medical terminology book, that shows you the different cancers and the gene that's implicated in that form of heredity. So breast, ovarian, leukemia, polyposis coli syndrome, renal cell carcinoma, Wilms tumors, retinoblastoma. These are all cancers that where genes are implicated. Okay, so which means that you can have what is called genetic screening, which can test you for these genes, and I'm pretty sure like the gene for breast cancer, the BRCA1 gene. Many of you have heard of Angelina Jolie. She tested positive for that BRCA1 gene, and she took the choice of removing both. She had a bilateral mastectomy, which means that she removed both masses of breast tissue because she was at high risk for breast cancer. So she tested positive for the BRCA1 gene. So there is genetic screening for these things. Okay, so carcinomas. 90% of all malignancies are considered carcinomas. Okay, so we know that carcinomas, like colon, esophagus, liver, stomach, they have different forms of carcinoma. Okay, so sarcomas are about 5% of all malignancy. They're usually from connective tissue origin, where carcinomas are of epithelial origin. So like bone tissue, muscle tissue, cartilage, fat. These are all types of connective tissue. The malignancies that you can get are things like osteosarcoma, which is like bone cancer, chondrosarcoma, which is cancer of the cartilage, liposarcoma, which is fat cancer, and there are many different or various forms of these types of tumors. So you always look at different types of pathology under the microscope to describe different types of cancers. So it's either alveolar, it could be a carcinoma in situ, it could be diffuse, it could be dysplastic, epidermoid, follicular, it can be nodular, it could be papillary, it could be pleomorphic, it could be undifferentiated. These are all different types of pathological descriptions of that pathologist, which are specialists who study pathology under the microscope to try to see what type of description that they can get on the tumor. Now, something very important, when you look at tumors, you look at grading them and the staging of the tumors. So grading tumors, so I think it would be fair to define what is a grade and what is a stage when it comes to a tumor. So grade, you're looking at the maturity of the tumor, or if it's differentiated under the microscope, and the stage is how badly did it spread in the body. Okay, so grade and stage is very important. And in our wonderful textbook, we also have a table that actually that shows you the different stages: 1A, 1B, 2A, 2B, and it tells you the description and the survival rate and things like that. So I would look at the, it's called the International TNM staging system of the different types of cancers. And I think in our book it uses lung cancer as one of the examples. So there are many cancer treatment options like surgery. So we have something called a debulking procedure where they use, so something is used to remove the primary tumor mass. Okay. They also have radiation therapy and chemotherapy. So after you remove the mass, you can have radiation or chemotherapy to prevent the recurrence at the site of the cancer. You also have excisional biopsy, you have fine needle aspiration biopsy, you have incisional biopsy, you have cryosurgery, and there are so many different cancer treatments, and it all depends on the type of cancer that you have. Okay, radiation therapy, there's so many different types, and our book goes into so many different types of radiation therapy, like electron beams, external beams, fractionations, gray, linear, acceleration, simulation, and so on and so forth. But I think something that's very important is to really look at the side effects of radiation therapy, and one of the things is baldness, and the term that we use for baldness is called alopecia, and alopecia is another term that we use for baldness. Fertility, difficult to conceptual, mucus, which is inflammation of mucous membrane.
Based upon the type of cancer you have. So, just to this a little set of cancer oncological terminology, guys to at the Greek is one of these terms is as equally important. I hope you enjoyed this lecture, and I'll see you guys in the next lecture. Thank you.